What I want to talk about with you today is really the ways in which I think about culturally responsive school mental health. And I believe in working with youth of color in a way that may be different in what we are trained in our training programs to do. And in doing so, I think from the perspective of fostering resilience among students of color. So I'll begin by just having us, what would like for you to kind of notice the body of the slide, and that we are looking at a bottle and a message in a bottle. And I'm hoping that you will see the theme of this throughout my presentation on the ways in which we can respond to the needs of youth and helping continue and build with their resilience. So before I move on, let's next slide, please. I just want to share a little bit about myself, because oftentimes people want to know where you're coming from when you are sharing your perspectives, and it might reveal some of the ways, the reasons why I think the way that I do. I like showing this slide because this child is representative of a lot of things in my life and experiences that I've had, and the interests that I have shaped when it comes to the research that I do. In my early years as a mental health professional, I worked in Compton, California, and I worked for a program that was serving youth of incarcerated parents. And I was in a training program. I was working as a paraprofessional when I did this work. And I was in a training program where I was reading about exposure to chronic community violence, and I was trying to learn more about African-American youth and the ways in which they were being able to cope, because some of the youth that I was working with in these schools with incarcerated parents also were exposed to chronic community violence. And what I was learning, this is in the early 90s, and everything that I was reading to prepare for my groups was deficit focused. Everything was talking about the prevalence of disorders, the violence in Black communities, and the ways that kids were perpetrating violence or victims of violence, but nothing around strengths. And it troubled me, and it was confusing to me that I didn't see anything positive about my own community. Meanwhile, I'm serving these kids and I'm seeing how incredibly strong they were and how they were resilient despite being exposed to some of the worst circumstances you could imagine. So it just led me to study what fosters resilience in African-American children and adolescents, particularly when they're exposed to chronic community violence. And at the end of my talk, I'll share a study that I did in Houston, Texas, with kids of the same population and how resilience kind of manifested. But in general, my work focuses on adapting evidence-based interventions with a lens of cultivating resilience within the cultural context. So what works in one culture may not be effective in another. And so this is the reason why I'll talk to you about kind of common variables that you would want to be thinking about as you serve youth of color, and the unique stressors that are experienced by them in particular. So I do have a bias. Let me just say what my bias is, that I believe that without an intentional focus on culturally responsive practice, it just doesn't happen. So my hope today is that I can show you where culturally responsive practices kind of fit in evidence-based interventions and evidence-based practice. Next slide, please. So as we think about the evidence-based practice, I'm using the model that was defined by the American Psychological Association with what we refer to as the three-legged stool. And basically paying attention to that evidence-based practice includes the best scientific evidence, of course. So research that is telling us what is the best scientific evidence for serving a particular mental health problem. At the same time, we also need to recognize that clinician expertise, and it has to be integrated into that best research evidence with their clinical judgment as a major part, or your clinical judgment as a major part of what you do. But at the same time as when we're paying attention to clinician expertise, we also have to recognize that as clinicians, that we have to be aware of the limits of our own knowledge and our own skills, and the blind spots that can affect our clinical judgment. So 2 legs of the stool reference the research that exists and ourselves as clinicians, and our degree of expertise and our own awareness of our own knowledge and limits of our knowledge. And then, most importantly, is the third leg of the stool. Notice it wouldn't be able to stand without this third leg. And that is to pay attention to client characteristics. And by client characteristics, I'm referring to things like sociocultural and family factors, including things like gender, gender identity, ethnicity, race, social class, religion, disability status, family structure, sexual orientation. All of those are sociocultural factors that we need to consider as we are doing our work. We also need to pay attention to the environmental context, and that includes things like institutional racism, healthcare disparities, stressors such as unemployment or major life events that are traumas. We also have to look at personal preference. So that's the personal preferences and values of the clients that we're serving, and the preferences related to treatment and the ways in which they think about treatment and their worldview. So a central goal of evidence-based practice or evidence-based interventions is to maximize patient choice among effective alternative interventions. That's a critical element that we seem to lose sight of at times, where we really give much more weight to the best scientific evidence as the major thing to pay attention to. Next slide, please. So you probably have been familiar with the concept of ACEs, or adverse childhood experiences. One of our sponsors today is Kaiser Permanente, and this was originated by a study by Felitti, Anda, and et al. Back in 1998, where they were studying the long-term outcomes of individuals and what happens when they're exposed to these experiences during childhood. And the original study, as well as many more that have been replicated since then, show that those with 4 or more ACEs, or adverse childhood experiences, have an increased likelihood of serious health problems throughout life. And so they were looking back, and so studying people that were adults, and looked at childhood experiences that perpetuated and created a context for potential conditions such as depression, anxiety, suicide risk, and substance use. And so it was very clear from these studies that it's critical to address these experiences earlier in life. So one of the things that I want to point out in this graphic that you can see, you've probably seen it many times before, but one thing to notice about it is that the ACEs in this study, most of them are related to this childhood adversity is because of adult decisions, adult behaviors, and adult circumstances. That's really important to notice, because then that tells us that as we are serving youth, that we, in order to serve them and intervene well with children, we have to engage the adults in everything that we do. If much of the adversity is due to the adults around them, we have to engage adults in everything that we do. So critical point about ACEs. But I'd like to expand upon this concept of ACEs. Next slide, please. As we are looking at the top part of this graphic, you can see the tree includes the ACEs that I just described, so adverse childhood experiences that we know that are part of the challenges that youth may experience in life. But I'd like for you to look below the soil. Look at the underground and another form of adverse childhood experiences. And so this study was done in 2017, where there was a notice that, or recognition that their adversity is not just within the family, but also within a community. So we have a pair of ACEs here, that we have individual and family ACEs as well as community ACEs. And notice that the ACEs below are a foundation of systemic inequities, systemic. So that tells us that if there's the foundation and we have these ACEs that are above the surface and part of the tree, when we consider that, the pair of ACEs model, we have to really recognize that adverse community environments become another factor for consideration when we're working with stressed youth. So, and in particular, I'd like to draw your attention to one community ACE. Click, please. And that is discrimination. That this is one that needs to be recognized and has recently been more importantly noticed in some of the national studies that we have. And I'll tell you about two where we've included them. So next slide, please. Here, the Philadelphia, National Survey of Children's Health in 2016 shows that I'm showing here that they had decided to include racism and discrimination among one of the ACE indicators that they would study to kind of determine the prevalence of it, particularly in the national survey. And you can see the bottom item H, it might be a little small, but it's basically identifying having adverse experiences related to being a member of a racial group. Click, please. Then in the Philadelphia Urban ACE study, I want to show some of the differences that they found by race. And what they were looking at were urban indicators of community ACEs, including witnessing violence, feeling discrimination, adverse neighborhood experiences, being bullied, and living in foster care. And I want you to notice the asterisks next to the percentages. So on the left side, they compared white youth to Black youth on the right side. And you can see that when there is a single asterisk, that's saying like there was a significant difference between the populations. The greater number of the asterisks, the greater the significance level. And you can see that there are 3 asterisks for witness violence, feeling discrimination, and for adverse neighborhood experience, and then also for living in foster care. So when you see these massive prevalence differences, it tells us that these experiences matter too, and they're now perceived to be clustered among the ACEs that we need to be aware of, but in particular for Black youth. Next slide, please. So as we think of adverse community experiences for children and adolescents of color, I just want you to recognize that there's significant complexity in whether they can cope with a range of ACEs, including community violence and discrimination and foster care. But some are more subtle than others. And so that's where I'm going to go now, is really talk about some of those more subtle ones that we may not pay attention to. And I want to describe a couple of concepts that relate to adolescence experiences that adults need to be aware of. And I see these as threats to resilience. Click, please. So take a look at this video clip. Next slide. What's happening here? It was a little glitchy there, but what you saw was a person that was walking up, looking inside a car window, and looked at the back, looked at the front, and then walked away. The question I have for you is, car thief or lost keys? When I watched that video the first time, I had an impression that I interpreted based on experiences that I've had. What we just saw, we had really limited information. We had no sound, we had no context, we were just observers. So what we do is we tend to align with what's familiar. With limited information, we also usually perceive a situation negatively if the other, somebody who's different from us, doesn't make sense to us. When I saw the video the first time, the first thing I thought was lost keys. The reason why I thought it was lost keys is because I once had a car that did not have a key fob, and I had to put my key in the door to lock the car, but I could push the button down to get out of the car and locked my keys in many, many times. And the experience that I had looking for my keys was to keep going back and hoping that they were going to suddenly magically appear on the seat. They never did, but that was what would happen with me. And I saw that in him. He looked like he'd been at the car before. He looked like he had come by before. And what told me that was the ways in which he glided his fingers along the window as he walked away. But you may not have experienced it that way. You may have experienced the thought that he was a car thief. In fact, when I purchased this video clip, the title of the video clip was Car Thief, and it surprised me. The reason why we see this differently is implicit bias. These are culturally based assumptions that we make in a millisecond, and they guide our behavior. We don't really know what we're thinking until we actually take an action oftentimes. But what's happening with implicit bias is they're shortcuts. It's our brain doing what it can to process complex information efficiently. They just our brains add in details. We're hardwired to fill in the blanks. So that's what we were just doing when we looked at this video. So you might feel bad if you assumed he was a car thief, and I want you to not feel bad. Please don't, because our society has primed you for that by portraying Black men as criminals. Our society primed you for it. So you're likely to have filled in the blanks based on that experience. Society preparing you or priming you to think that way. But we can do something about that. It means that you have to fight against implicit bias. You have to intentionally fill in the blanks by seeking additional information before acting. Next slide, please. Our behavior is powerfully guided by the things we expect to be true. So when we interact with people based on limited information or implicit bias, or we can refer to these as maybe cultural blind spots, some people have to have the experience of people interacting with them based on implicit bias all day long. And they have to figure out how to cope and manage around those feelings and not get overwhelmed and overburdened with trying to interpret what those feelings are. Some people are impacted by implicit bias every day, and the experience is like when other people make decisions about who you are, what you're capable of, or making predictions about what you might or might not do. That's an adverse experience for many BIPOC youth, Black, Indigenous, people of color, especially Black boys. Now, from here forward, I'm probably going to I'll use the term BIPOC. And the reason why I want to use the term BIPOC is to center Black and Indigenous, because many of our practices in schools have the greatest negative impact on Black and Indigenous students in particular. And so I will use that term BIPOC, but also I'm referring to youth of color, but my examples, you will kind of see how that fits in. Next slide, please. So oftentimes people feel a little bit helpless when I talk about implicit bias or cultural blind spots and the ways in which we deal with this automatic process that happens in our minds. And I don't want you to feel helpless. There is plenty of research out there that has shown successful ways in disrupting patterns of implicit bias and cultural blind spots. So I'll just describe a couple here. Individuation is really taking intentional efforts to really see the person as an individual and unique, and someone that demands your respect and time to get to know them. Perspective taking is to get a sense of what it might feel like being that person's shoes and separating yourself from your thoughts and really trying to become positioned in their position. Increasing opportunity for contact is in building relationships, having relationships with people beyond your own racial or cultural group that are in your personal life, not just in places that you must be or like work. Stereotype replacement and counter stereotypic imaging are similar, where they are two approaches where you intentionally fight against stereotypes. So listening to what a stereotype might be, but replacing it with the actual opposite, and then applying that example to people that you're interacting with that are from a group where that stereotype applies. And then the last two are studies around building a relationship and connecting. And so tracking personal information, learning about a person, and then really repeating it back to them as you see them and acknowledging those unique aspects of them. And then banking time is really listening and spending time validating. So these techniques are not only to fight against those cultural blind spots, but they also can be and should be part of interventions that you're doing with the youth that you're serving. You can even help other adults that are working with a population of youth by pointing out ways to use these techniques. Next slide, please. So the next couple of slides, I'm going to be talking about the silent struggles that affect BIPOC youth. And I want to start with a video because I feel like the youth say it better than me. So next slide.
Oh, you're so pretty for a black girl.
Oh, she has a Jew nose.
Oh, your hair would look so good if it was straight.
Jews are so cheap. Why are you so cheap?
Do you speak good English?
How are you an Iraqi Jew?
I think the person saying microaggression kind of doesn't really think about it.
This person who said it was my friend, and like I was astonished that they would like say something like that.
You don't want to make a big deal about it, but then it's also like you just said something that offended me, so I feel like I should speak up.
Because they're micro, because they're very subtle, they're small, you feel like you don't have a reason to be upset. You're overreacting, and people even can make you feel that way when you bring it up.
They're like, oh, you can't take a joke.
You're making too big of a deal of this. Why are you overreacting?
Don't take it so seriously. It was just a joke. Chill out.
Say like, oh no, I actually love black people. I love people of color. Like they try to just minimize the situation.
If someone feels hurt by a microaggression, it shouldn't just be pushed to the side.
It definitely has negative impacts and like leads to people disliking who they actually are.
Those kinds of subtle offensive comments can build up over time, and they can have like a deep psychological effect, and you know, they can make you feel bad and they can make you doubt yourself.
We try to just use jokes to like make things less awkward or like ease social experiences, but it is important because you need to like be aware of what you're saying and like who you're speaking to.
Think of what you say and how it can affect the person you're saying it to.
I find that video to be so powerful because those young people are so articulate about their experience, not just what the experience is, but what it does to them and what it means to them over time and how it impacts their self-esteem. I hope you saw the numbers that they said 291, the study was showing 291 microaggressions in a matter of months. It's incredible as you think about how pervasive they are. And I probably should define it because they kind of didn't define it for you. So what microaggressions are, they're brief, everyday exchanges, and what they do is they send denigrating messages to certain people because of their group membership. And the statements usually affirm stereotypes about a group member, and they're usually subtle insults. They're considered microaggressions because they're unintentional by the deliverer. We've all done it. We've all made the mistake. But we have to know that even though they're unintentional to the deliverer, they feel like tiny little cuts to the receiver. They just do. So when we're not self-aware, we are sometimes unable to recognize when our words negatively impact other people. And they unfortunately happen in the midst of interactions that can happen anytime, just being in conversation. And it's tough because when they happen, oftentimes what happens, I call this a silent struggle for many youth, because then they don't have anybody to go talk to about it. Or they have a friend, but they can't get to them right away because they have to go into class and they have to sit with it, and they try to make sense of it, and they try to make sense of it in the context of the relationship that they have with the person that delivered the microaggression. So I love showing that video because of the way they frame it, and I think that it makes it really real for a lot of people. What I want you to take away from it at this time that you've seen it and heard about microaggressions is many and most youth of color in particular are dealing with it in silence. Next slide, please. So if we think about now, we've got implicit bias that is one of those things, those automatic shortcuts that are impacting the relationships that that the youth are experiencing. And then we have microaggressions notice the connection that oftentimes microaggressions are steeped in stereotypes, much like implicit biases. They start to have, their identity starts getting impacted because they're having repeated experiences with that bias and those microaggressions being delivered, and they start to learn how stereotypes are applied to them. And they start feeling powerless in shaping their own identity. They learn that there are limits to what they can control. So for example, when evidence of implicit bias occurs or microaggressions are delivered, they experience an immediate fear of confirming a negative stereotype, especially when it's attached to a stereotype. And this is referred to as stereotype threat. Some people respond in a way where they give the opposite reaction to the threat of a stereotype being applied to them. Others passively accept the assumption, and they just kind of go with it and just say, well, they're going to think what they're going to think, and I'm just going to ignore it. Some even give up, and they will enact the stereotype as a way of taking ownership of and control over it. But all of these responses, they're all subtle experiences. They're all happening inside their head, and they take up a whole lot of headspace. So this process of stereotype threat, it impacts development and growth and can hinder academic achievement. There's lots and lots of studies that you can read about stereotype threat. If you want to learn more, look at the work of Claude Steele and Joshua Aronson that have done many studies of adolescents in school settings and the impact of stereotype threat on their academics. So now we've got a couple of concepts here that are part of the silent struggles: the implicit bias, we have microaggressions, now we have stereotype threat, and these are all subtle manifestations of discrimination, which is one of those community ACEs that I mentioned before. Next slide, please. So this slide, what I would like you to see is how it all fits together. Next slide, please. So on this slide, I have a interaction that is occurring between a teacher and a student. And so the teacher, as the student walks in, her name is Tanisha, he says, "You should be on time, Tanisha. You need all the time we have to learn the material." And the thought bubble above Tanisha says, "Oh, I bet he thinks all Black people are always late." So she was responding to a stereotype about Black people and feeling insecure about she was arriving to class late. But there was also something in his statement, and it was an inflection on a particular word that may also affect Tanisha as she's walking to her seat to go and sit down. And it was the word all, when he said, "You need all the time we have to learn the material." The first part, where she responded to the lateness and was thinking about and feeling insecure about the lateness, that isn't a stereotype around time and respect for time in the Black community. But she also then may notice the microaggression, the one about intellect, about she needs all the time we have to learn the material. Those were embedded in his words, and that can disrupt learning. If you could imagine Tanisha walking to her seat going, "Oh my gosh, I can't believe I'm late, and I had to, but I couldn't help it." And then she sits down and she's like, "Wait, he said I need all the time we have, and he said it in front of everybody. Does everybody think I'm dumb? Maybe I am dumb. I don't know. Maybe I do need all the time, because it really takes someone to tell me things multiple times, and every time I learn it, it doesn't really stick. So I shouldn't be here." So I say all of that is a little exaggerating there, but at the same time, look and listen to how much headspace that took up, that she's over processing. Do you think she learned anything that he was teaching in that time while she's sitting there over processing, trying to make sense of the microaggression that was delivered publicly in front of her classmates? She's probably learning nothing. And on top of that, she's probably not telling anybody that that's what she just experienced, because it's so common that she's just kind of got to work through it on her own. It's a silent struggle. But let me show you a different one. Click, please. The teacher says, "Mei Lee, will you explain the concept to the class? I'm sure you understand." And Mei Lee, her little thought bubble, says, I better pretend like I get it and be the smart Asian he expects. She's responding to the stereotype of the model minority myth that we have around Asian Americans and intellect. He's suggesting that she's more likely to understand the material, potentially because she's Asian, and she is responding to that stereotype. The model minority myth is a harmful stereotype as well. And in particular, it's because that is not truth for everyone. And so if it's an assumption or an expectation, then it's even more damaging to an Asian student who isn't understanding the material. They're feeling even more inferior and like something is really wrong with them. So here's another version, a way that a teacher can say something to a student and the student respond internally and not have anyone to talk to about it. It's a silent struggle. And then the last thought bubble is just one where the teacher didn't say anything, but the student is still having a feeling around why they're placed in the back of the room. And they're making an assumption. Why should I pay attention? He put me back here for a reason. And that could be nothing to do with that teacher. It could be related to other experiences that they had in other classes where they positioned people in a certain way. But all of these, they're kind of strong examples. They're all real examples of kids that I've worked with that have told me that these are things that they have had said to them. But they're all examples of how interactions can promote a stress response and disrupt learning for youth and be that invisible or silent struggle. And for adults, it's these internal conversations we are not privy to. So there's this huge cognitive load on the students, but we have no idea that this is what they're going through and what they're experiencing unless we create the space and context for it. Next slide, please. So our kids, they send out an SOS and they do it different ways. So kids and adolescents, they have different ways of sending out the signals of distress, and they may vary by gender, by personality, by cultural values, and by life experiences. Irritability, anger, sadness, those are pretty easy to recognize for most of us. But what we don't recognize are things like isolation, anxiety, avoidance, and even apathy. So when we pay attention to these silent struggles, we may get a window into the isolation, avoidance, apathy, and anxiety. But without an intentional focus on addressing these hard to see emotions, we just may miss things that can actually really help them. We can also make things worse. There are things that we do to encourage BIPOC youth to internalize their emotions and avoid asking us for help. Here's some examples. Next slide, please. So minimization. I think you might be taking that out of context. Or, are you sure you aren't being too sensitive? Or dismissiveness. Oh, I'm sure that's not what they meant. Or defensiveness. Well, I am certain your teacher has the best of intentions. I'm sure these sound familiar. We've all said them at some point or another. Recognize that these are encouraging our youth not to share. We're encouraging them to hold things in and internalize them as if it's their problem, not someone else's. So keep in mind that we're lucky when BIPOC youth trust us enough to talk or defend themselves or advocate for themselves. So if we do these things, minimization, dismissive statements, or defensiveness, we destroy that trust. So be careful about what you say and lean in the direction of listening even more. Next slide, please. So a couple things. One thing that I really think is important for us to know is we have plenty of research that shows that resilience from ACEs can be activated by the existence of safe, nurturing relationships with adults and peers. We know this. It is absolutely clear, and it's been replicated across many studies and meta-analyses. So part of this is listening, validating their feelings, sharing counter narratives to implicit bias, stereotype, and microaggressions. That's part of it. But I want to share a study that I did years ago where I was going back to chronic community violence and complex post-traumatic stress disorder. Next slide, please. And you can click through. I was looking at chronic community violence, and complex post-traumatic stress disorder. And what I wanted to do was identify cultural variables that I thought exist in African American families that might be protective factors, and identified 3 that I was trying to study. So formal kinship, the blood relationships that are among family members, and then informal kinship. And these are people that are family, they're perceived as family, but they're actually not blood related. So in my family, we refer to them as play cousins or auntie or uncle or big mama. Those were people that were in my life that really were perceived as family. And there was one in particular, an uncle that I actually thought was my uncle and wasn't my uncle, but that's because that's how ingrained they were to the family. And then spirituality, the ways in which Black families use spirituality to cope with conflict and adversity. And what I found in the study was that all those that had the most of all 3 of these variables, that there was actually a buffering effect where they showed the least amount of complex post-traumatic stress disorder because of the existence of these factors, regardless of the kind of violence they were exposed to. And these youth, they were between the ages of 11 and 15 and had been exposed to murder and severe violence, and still showed fewer symptoms of complex PTSD when they had access to these protective mechanisms. So next slide, please. As we try to do our best to respond to the SOS, we want to recognize that adverse childhood experiences exposure create toxic stress. The interventions that we typically do are for symptom reduction. So we'll do things like teaching emotion regulation skills and doing psychoeducation about what trauma is. Click, please. And that rarely includes cultural integration. Click, please. If we think about interventions that are resilience focused, then we're going to add on and include things like identifying and applying individual strengths. We will also be doing such as maximizing relationships, and we'll also be fostering community support. Click, please. And this often includes cultural integration. So if we focus on both symptom reduction and resilience promotion, it requires integrating the sociocultural context. Next slide, please. So I'd like to kind of end with a metaphor that I like to use to help folks understand the ways in which I think about resilience. So I'm showing a cell here, and what I want you to see about this cell is I see resilience as the nucleus of the cell, or the center and the core of the cell. So if you're familiar with kind of microbiology, that the nucleus of the cell has a fluid around it called cytoplasm. And this fluid is designed to protect the nucleus. So what I have inside this cell here is resilience as the nucleus, and the cytoplasm, including cultural factors that I believe for many communities of color are protective. So things such as having a strong sense of spirituality, or the kinship that I described in the previous study, racial socialization, where family members are really helping youth understand and know the ways that they can be successful and cope with conflict around their racial identity, building racial and ethnic identity as part of who they are, and feeling good and confident about that. Having a collectivistic perspective where you're one of community, not just an individual, and cultural norms and an understanding of acculturation, that all of those things are protective. And if we recognize that for resilience in the nucleus to be maintained, the environment, the cytoplasm, must be safe for healthy growth. And when protective factors are ignored by the nurturing environment that the cell lives in, maybe schools, it implies that they're unimportant. So if our nurturing environment does not pay attention to these protective factors inside the cell, it implies that they're unimportant. And that minimization weakens the cell membrane, which is the outside, that light green line, and it makes the person more vulnerable to pathogens. Click, please. The pathogens in this metaphor are things such as implicit bias and ACEs and stereotype threat and those microaggressions that I talked about. If this pathogen binds with this healthy cell, it can break it down completely until the nucleus is absorbed. That destroys the cell and subsequently destroys resilience. So I am of the mind that culturally responsive practices not only protect the nucleus, but they also strengthen that cell membrane so that the pathogen cannot bind with the healthy cell. So keep that image in mind as you think about the importance of cultural factors and as protective. Next slide, please. So if we intentionally foster resilience and we keep in awareness the full identities of our youth, kids will not have to endure school. Kids of color, BIPOC kids, will not have to endure school. They can thrive in resilience.